Hospital when the Hospital of Hope went live on Friday. It is one of several temporary medical facilities and quarantine and isolation facilities established in that province. Of course, the Western Cape right now has the highest infection rate in South Africa. Let's see if he's up. We have the Western Cape Premier, Winde, on the line. Premier, can you hear me?
Yes, I can.
Great. Thank you for joining us. Were the patients admitted as expected today to the Hospital of Hope?
Correct. The first 10 patients arrived this afternoon. And so that hospital, 6 weeks ago, we said it's going to be up and running on the 8th, and it's actually up and running on the 8th. So, yeah, really great achievement and an outstanding facility. It really put a lot of people under pressure, but they came through. So that's our second one that we've opened as a field hospital. The first one was in Khayelitsha. And this with a partnership with Medicine Sans Frontières that opened last week, and now this one, the biggest in South Africa actually, in beds wise, has now opened officially.
Well, explain the logistics of turning a convention centre into a field hospital. I mean, how comfortable will these patients be? Will they have access to equipment, emergency treatment that they would in an ordinary hospital?
Okay, so first of all, we must understand that this hospital is not, it's not an ICU facility, and it is not a mainstream hospital. This hospital is more a kind of recovery hospital. So what happens is when you don't, or you no longer need ICU, or you are not that seriously ill, we'll move you through to this hospital or one of our 4 and perhaps 5. We're busy negotiating the 5th one at the moment. And so it is really a hospital of recovery. It is Wi-Fi enabled, tech enabled. It's paperless, so no paper being carried around to try and limit the spread of the virus and also make it as sterile as possible, but also enabling us to innovate and learn. So I'm sure this is going to reverse back into many of our other hospitals. And yeah, it was a 4-week project, dedicated teams from public works to the construction teams to the health team supervising in what was needed. And yeah, we're very proud of it.
So around 800 or more beds, but you say more of these field hospitals are coming online, much more needed. You know, how many beds are going to be needed at the peak, and how many are being provided? And I'm also interested in the models being used, because we know there's a looming court case because national government is not releasing those underlying model, that data. Are you using the same data to kind of prepare, or different?
Okay, so we initially used our own data with our own modelers brought in from our local universities, and our health professionals. And our initial model gave us the 1,400 beds that we needed to put in place. In actual fact, it was less. It was initially 1,000, but we built 1,400 because we're not able to build the ICU beds that are needed. But we did a recalibration of our model, and we asked 2 different organizations, the national organization, that's a partnership, as well as the Actuarial Society of South Africa, to review our models. And both of them actually said we should revise our models up. So we have now, that's the discussion that we're having at the moment, is to use the second CTICC building. That can put another 800 beds in place. So we're busy at the moment on that while we're finishing off the last 2 of our field hospitals. And then we've also now started to up our quarantine and isolation facilities. Initially just under 3,000 beds. We've now in the plan already got 9,000 beds, and we'll be having a look at what we need to do now if we need to up that as well.
All right, and beds are one thing, but then of course you need the doctors and the nurses as well. You reportedly want to recruit more than 5,000 health workers, and I don't want to be cynical, but there's finite resources, doctors needed in all provinces. That sounds like an impossible task.
So first of all, we've got 1,600 volunteers who've already put their names forward. So that is really amazing when health professionals are volunteering their time. Perhaps they were doing something else or a different career, but they've got a qualification, and they've been putting their name forward. We've already got agreement because our curve is earlier than other parts of the country, is that we will also share resources. So I'm pleased to say that we've already got some nurses from KZN that are at the CTRCC. And so what will happen is when we go over our curve, the commitment is that we, again, will also support those other provinces who need extra staffing, because we need extra staffing around the whole country. And, of course, we're putting out the word. And, anybody who would like to come along and help us through this process, it's a couple of months. And, we really are looking for qualified people. It is frontline. And we understand the pressures that you face in the front line, but it is quite amazing to see the people that are stepping up.
All right, Premier, the President visited last week. He wrote today in his weekly letter that he was impressed with the preparations, but it's clear your province needs assistance. Are the national and provincial governments working well on this, in your opinion?
So I think we've really had a lot of support from Minister Mkhize. He's been to visit our province a number of times. And I mean, our health department and the National Health Department, the modelers, everybody works very well together. They meet twice a day at least as a management team. They really do. And I think there's been a lot of cooperation, and I really value that. I think that, obviously the areas that we are under pressure is testing, and we've had a big backlog in testing as South Africa. And that's putting us under pressure, especially because we're ahead of the other provinces and our numbers are much higher. So, the testing volumes. And there again, there's commitment from the minister to actually make sure that we get a better proportion of testing post our meetings. And I really value that as well. And then, of course, there's the staffing issue, which it seems like we've got some agreement. And then, of course, the big problem is that provinces don't have their own taxation system. We get a division of revenue via the national tax system. Money has been made available globally at South Africa level for health interventions. We are just asking now for clarity on how much, because it's the numbers are starting to rise, and that's put us under pressure.
Premier, we're running out of time, but I did want to ask you, it's been suggested that the Western Cape is facing these incredible numbers because there's a lot of flouting of lockdown regulations. Is there a sense of impunity in the Western Cape? And if there is, what are you doing about that as a leader?
Okay, so I mean, I don't see any difference in between this part of the country and other parts. But I mean, we really have, pushed hard with our communications. It was agreed that we'll up even our communications as we are at the moment. Trying to get people to understand that the new normal is the new normal. It means that you must wear your mask, you must social distance, you must make sure you follow the hygiene practices. It's about citizens, it's about businesses, it's about daily lives. And I mean, obviously it's a concern because the more, congregation and congestion of people, the higher your risk is. And so, I mean, we really are trying proactive and innovative ways to deal with this. We showed the President our red dot taxi system, so we don't have to put our frontline workers who are really susceptible into public transport. We've arranged through taxi unions a specific booking system, so you can book your transport from home to your hospital or your clinic and back again. We really are trying specific things, and then we've developed the hotspot model, which really brings in the whole of government and the whole of society working together to make sure that we're trying to bring down the spread, manage that curve so that we can get past the peak, which is now in our province going to happen at the end of June, beginning of July, according to our models. And it's a lot of work, and we've all got to do it together.
But you spoke about the testing backlog, and I understand you're not testing people under the age of 55 unless they have those underlying conditions. I mean, how then can you not start missing hotspots?
No, it's not that you can't miss. I mean, we've got a common practice that if you've got any symptom, you make sure that you self-isolate. But when you have a restriction in supply, you have to make management decisions. And so that management decision we made was test where you have to test. You must test in your hospital because you must make sure that your client coming into the hospital is either COVID-19 and must go in the COVID-19 ward and pathway, or if not, we need to keep them away from that pathway and treat them for whatever other symptoms or their needs. And so that's really critical. We have to test our frontline workers, our nurses specifically, regularly, because they also need surety. And then we've also said we'll test people older than 55 and with comorbidities. And that might last for another couple of days until we have sufficient tests in South Africa, and then we can go back to normal testing. And interesting, I try and review what we do from around the world. Today I was having a discussion with the National Health System in the UK, who put their field hospitals together, and I was just asking if there are any lessons that we need to learn. And at their stage of testing shortfalls, they didn't even have capacity to test people with comorbidities or elderly. They could only test people in hospitals because they had such shortfalls. We don't have those kind of decisions to make yet, but we have been under pressure, and hopefully it sounds like in the next couple of days we'll be able to open up our testing again.
All right, thank you for your time tonight. That was the Western Cape Premier, Alan Winde.